And we're back with Dr. K. Dr. Kevin Cavanaugh is a retired physician from Somerset, Kentucky. He also founded an organization that is growing by the day called Health Watch USA. Hey, good morning, Dr. K.
Good morning, Jack. Well, we're a nonprofit organization composed primarily of volunteer, either academic, research, but also a lot of patient advocates that are scattered around the nation. And we've had some members in participation actually around the world who have come in to help us with our endeavors. We do focus on infectious disease, which is one of the reasons why we have engaged so much with this COVID-19 pandemic.
All right, let's start. Tell us about Pfizer and the development of something they're working on.
Right. Well, Pfizer is working on a new vaccine for the Delta variant because, as you know, it's been very problematic with evading immunity. In other words, it will cause infections, but luckily it's not causing real severe illness such as dying or becoming hospitalized. If you're vaccinated, you've got good protection for that. Not complete, but good. But Pfizer is trying to develop a vaccine just for the Delta variant. They're also looking at some data out of Israel and thinking it is best that they start to also work on a booster. And so for those that have been vaccinated or those that have had COVID in the past, it looks like immunity may wane over time. It's a possibility, and so Pfizer's also trying to work on a booster. So they're being very proactive, getting us medications and ways that we can avoid getting severely sick. Of course, the other way of avoiding getting severely sick is to still follow some common sense strategies to avoid the virus, and for everybody in your community that can to get vaccinated, because that protects everybody, not just yourself, but also other people.
What are those common sense things we need to be doing?
Well, what I would do with the Delta variant, especially if you're elderly or if you're at high risk or immunosuppressed, I still avoid indoor settings. I will still wear a mask in indoor settings. And certainly if you're in an environment where you're going to come up against strangers that have been traveling from faraway lands, such as in an airport or on a cruise ship, believe me, that's one of the places I would avoid is cruise ships. You know, those are places you want to consider wearing a mask. The CDC does not recommend that for vaccinated individuals. However, the WHO and many infectious disease experts do, simply because this Delta variant can spread. If you are vaccinated, you can still become infected. Much less of a chance, but still become infected. In a study out of Israel, I believe it was close to 35% of individuals could develop either an asymptomatic or mildly symptomatic infection. Nobody was in the hospital, but if you become infected, there's a chance you can spread it to others. Remember, about 3% of the population has an immunosuppressive type of an illness, whether it's lupus, rheumatoid arthritis, and patients that have had transplantations are extremely susceptible to the virus. And even if vaccinated, they may not have complete protection.
Now, you say Pfizer is asking for EUA for a third dose. Tell me about that.
Well, that's for the booster dose. And that is kind of a little bit of a surprise because it came off of research saying, hey, you're developing on histology these germinal centers that look like they have long-lasting immunity. And now they're saying, well, some of the data is showing that we may have more of a breakthrough infections than what we would like. And that's mainly coming out of Israel. Now, it should be remembered that Israel is a long ways away from the United States. Their Delta variant won't be exactly the same as our Delta variant is. So it's really hard to compare apples and oranges. They're similar, but these variants have just a plethora of different mutations. When they talk about variants, they're just talking about certain key mutations. So you may not have the exact same virus, but nevertheless, it is worrisome. And it's something that we need to, I think, be proactively looking at getting a booster for, because you want your immunity as high as it can be if and when you come up against someone that is spreading one of these variants.
All right, listen, we have an auto tech service text line question. Can you ask the doc where he recommends getting the N95 masks? Several months ago, he mentioned a place, and I forgot where it was. This is from Bill.
Well, I had purchased mine on Amazon, and that I think is a good place to get them. Of course, it was at a time period when everybody declared the pandemic over with, and the supply was much greater. I think right now people are starting to stock up on them. Because one of the other things that I should add is that even if you're mildly infected, you can still get long hauler syndrome, which is being reported in between 10 to 30% of individuals. And there's just been study after study after study that is currently coming out reporting long-lasting problems with the virus. So this is a difficult animal to wrestle with and something that you really want to avoid getting. So yes, I would try to get N95 masks, would get them on Amazon if you can, because there, if you do get some counterfeit ones, it can be returned. If they're 3M type of masks, which I think are probably the best and the ones that have been around the longest, I would certainly go on the website after you receive the masks and check the lot and serial numbers to make sure they're not counterfeit. And 3M has a whole website that allows you to do that. And that's how big of a problem is getting masks that are not correct. And even in the healthcare setting, that has been a problem.
The N95 mask is not absolutely necessary. It's just a better mask, right?
It's a better mask, yes. Surgical masks will also give you some protection. But remember, these are just layers of armor. It's not 100% protection. But for me, if I'm going to get a mask and I've got an N95 that you're able to get, that's what I'm going to pick up and get. I think that that's the best mask for this type of infection, if you can get it. And as I said, right now, supplies may be short.
Okay, here's another text. This gentleman is on the opposite side. This is from Dave. He says the Delta variant is a scam to cover up the side effects of the first vaccine. Then they recommend a booster shot for the Delta variant. This is all about generating revenue for the propagandist and drug companies. Total scam. What do you say to Dave?
That's craziness. Go on healthconference.org, which is our website, and listen to the infectious disease authorities from around the world. They are all struggling with this virus. Believe me, Kenya is getting crushed with this virus and they can't find vaccines. So the vaccines aren't causing it. And this pandemic, if you remember last year, was killing people before there was a vaccine. If you look at the hospitals, 99% of the people that are dying, actually the last I heard was over 99%, are those individuals who are not vaccinated. No, the Delta variant is real. The vaccines save lives. You need to get vaccinated because it will also slow down viral spread, which will slow down mutations. We have had a tremendous amount of mutations that have been coming out over the last year. And that is because we have been spreading the virus so much. And this needs to stop. There are other mutations out there which are even scarier than the Delta variant. So please get vaccinated.
Back with Dr. K, Dr. Kevin Cavanaugh. Lane Haslock is our producer. He's in the studio with us. And we had a news story this morning earlier, Lane, about a church over in Woodford County. They're asking that they not be identified that had a problem. Can you share that with us?
Sure. LEX 18 reports that a COVID-19 outbreak has been reported in Woodford County and is likely linked to recent church gathering in the area. Health officials say that at least 40 people have tested positive for the virus in Woodford County in the past 2 weeks, the majority of which were not vaccinated.
Okay. Dr. K, your response to that?
Well, yes, I've seen that story, and I think Woodford County is one of the counties which has a relatively high vaccination rate in Kentucky.
It is the highest, I think. Yeah.
Highest. And so if you're not vaccinated, you're still going to be susceptible, even in Kentucky where you're in areas that have a high vaccination rate. And if you gather indoors with this Delta variant, you've got a high likelihood of contracting this infection. Even gathering outdoors are problematic. I was quite disturbed with the pictures I saw on TV of the July 4th celebration in the mall in Washington, D.C., where you had numerous people crowded together. None of them were wearing masks. I saw children, which the vaccine isn't approved yet for, also not wearing masks, crowded together. And this isn't good. Outdoors will dissipate aerosols, but if you're close together, you can easily get droplet spread, even if it's outdoors. And with this Delta variant, it's a setup for getting a pandemic. Believe me, if you were criticizing people last year because of political rallies, it's the same this year, only worse, because this is a more spreading type of a virus. It spreads at least twice as easily as what the original virus did, possibly more.
Dallas asks, should the age groups not be lowered to allow those elementary school kids to get a vaccine? Do you think it should be lowered?
I think it needs to be lowered as soon as they can get the dosage figured out. Yes, that should be an absolute priority. The problem with the real young kids is how much dosage do you give with the vaccine? As you know, there have been some concerns with side effects. Rarely you could get myocarditis, probably dose related. You don't want to give the little kids too large of a dose. And so that's something I'm sure they're working on right now. In fact, I know they are. And I would suspect we're going to have a vaccine for the younger children very soon.
Here's a text on our Auto Tech Service text line from Josh. Josh says, someone told me that virus mutations, while possibly making them spread easier, don't actually affect the overall mortality rate. Is that true or false?
Well, it's hard to really tell right now. It can be false because if the virus spreads by making more viruses, in other words, it's making more of its soldiers, therefore you're more likely to pick it up, it also makes that infection more severe. So what we're seeing now, there is a tendency for more severe infections, but it's hard to tell because remember, we vaccinated not random, but people who are older and higher risk first. So that puts a real bias in the data of these mutations not causing you to be hospitalized because the people being infected are now being shifted to younger individuals. Now, of course, we're talking about hospitals and deaths here. Everybody is at risk for long COVID.
Let's go to the phones. This is Jim. Good morning, Jim.
Hello, good morning. And I appreciate what you're saying, but we have been whiplashed on this thing for almost a year and a half now. And I think that the individual can decide what they want to do. Yes, you're going to be in bed for a couple of days. You run a very, very small risk that you could die. And I'll say could, whatever. But it's just that no one has, I think it's all political at this point. You know, the numbers were looking great. As soon as Trump got out of office, how everything was improving and taking credit for this and saying how great everybody's doing. And now, for whatever reason, I don't know what it is. It could be a political money grab or whatever. We need to start doing this. And I think the American people are just absolutely tired of it.
Okay.
And just leave us alone.
All right. Thanks, Jim. We got to move along. This is Dr. K. We missed you or lost you during that phone call, but that caller, you there?
Yeah, I'm here, and I got the gist of it about it all being political.
Yeah.
Well, it's not political in many of the other countries. So again, go on healthconference.org and get an idea of what's going on. It has been politicized in the countries of the United States, Brazil, India, and also Spain. And those are 4 countries that, well, they haven't really done real well because when it gets politicized, it's hard to get people to rally around a strategy and implement it effectively. So yes, I think it is politicized. I can tell you that what I saw in the July 4th rally, if other administrations would have done that, there would be a tremendous amount of outcrying and deriding that type of a philosophy of having a political event when you've got the Delta variant spreading in the United States. I can't deny that, and that is very frustrating for me. We need to take this out of the realm of politics. But the presentations on healthconference.org, I think, are very elucidating. And some of these presenters, in fact, many of them are my friends. I have known them for many years now. Dr. Matthias out of Singapore, Dr. Dancer, Dr. Bagno, even Dr. Mitchell. These are good people, upright people, and they will tell you what's going on in other countries where you remove this cover of political influence which is going on in the United States. But that's why you can look for other sources of news and information.
Thank you, Dr. K. We'll talk to you next week.
Thank you, sir.